It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care, so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision-making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question in this series of questions from our client Sue. The question last week was part 1 of "My dad had end-stage HIV and is on ECMO in intensive care. Can he have a lung transplant?" And that was part 1 of this series of questions. You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from one of my clients, Sue, which are excerpts from phone and email counseling and consulting sessions with me. And the question this week is part 2 of "My dad has end-stage HIV and is on ECMO in intensive care. Can he have a lung transplant?" And again, that's part 2 of this series of questions from Sue, one of my clients. So Sue continues to describe her and her dad's situation as follows. Sue writes, "Hi Patrick. The doctors did request we attend as a family to a meeting tomorrow at 3 p.m. We didn't have a meeting in the end today, as the nurse couldn't give me a defined time and said they are very busy and cannot guarantee they could come to the meeting in case something comes up. I visited my father yesterday and they had continued trying to wean him off ECMO, but he's back on both sedatives as he was not coping well with breathing when they tried to wean ECMO off. To me, he looks like he's very drawn in, especially around his eyes. He's been in intensive care on ECMO now for 3.5 weeks, and other than continuing to try and wean him, we're not sure what the next steps are. He doesn't seem to be able to breathe independently without at least 35 to 40% of oxygen, and they have increased the oxygen pressure as well. They are cleaning him well and washing his mouth, being in a bed since the 7th of March, where he only came off to walk to the bathroom a handful of times prior to going onto the ECMO is really a concern for me. In addition, being under an induced coma for 4 weeks now is also a very long time, is it? The nurse yesterday mentioned the doctors can see us as a family if we still want to. It's possible my sister and I were trying to arrange a meeting at the same time and there has been miscommunication. They said he has been stable with the treatment he has been on, which has been going on a while now, and want to see what else they may do to progress things with my dad, if possible at all. Are there any key things I should bear in mind? I want to be prepared. I have read your article and know the importance of bargaining. I'm just not aware of what his options may be, not less they state them. But what if they don't? I appreciate any advice you can give. Many thanks, from Sue." So, here is my response. Hi Sue. As I have mentioned in our phone call yesterday, given that they want to meet tomorrow, you may get prepared for, first, the intensive care team wanting to talk about a withdrawal of treatment or a withdrawal of life support for your dad if he's not improving. Secondly, you may not want to attend the meeting in the first place if you think you and your family will experience unwanted pressure to agree to a withdrawal of treatment, especially if you are not ready for it. Your dad is in a very difficult situation, there is no doubt about it, after 3.5 weeks on ECMO and being unable to come off it. Nevertheless, on the one hand, I'm glad to hear that your dad is getting good nursing care with regular washes and mouth care. It's just as important as good medical care. Now, given that they are unable to wean your dad off ECMO by the sounds of things, and given that your dad has been in ICU now for such a long time, the next steps might be the intensive care team wanting to start discussions around withdrawing treatment and withdrawing ECMO in particular. Again, you may want to have a look at the following articles and videos to get more information on the subject matter. So, for example, you should look at how long can a critically ill patient stay on ECMO, and also how to wean off ECMO. I put those links to those articles and videos below this video in the written version of this blog. As we discussed yesterday, Sue, ECMO can be used for a bridge to a lung transplant. However, given that your dad is not even on a lung transplant list, I do unfortunately believe that if they can't wean the ECMO, that he will be approaching his end of life. Usually, VV ECMO for lung failure or for the severe pneumonia your dad is experiencing is being used to let the lungs heal and recover. Your dad's lungs have not been recovering. With the underlying and chronic HIV issue, that's probably been diagnosed too late. The odds are not in your dad's favor at this stage. Again, Sue, the combination of HIV, pneumonia and the VV ECMO for over 3.5 weeks make it unlikely to your dad getting a lung transplant or even being considered for such. At this point in time, there is a very good chance that if ECMO is being removed, your dad will pass away very quickly. I have seen this on a number of occasions. In clinical practice, that if ECMO can't be weaned and is being removed, that death unfortunately is inevitable. Therefore, at this stage, it's important your dad's suffering is minimized by the time life support is being removed. Now, if you have followed my blog for any length of time, you would know that I'm the first one to say that staying positive, trying to negotiate with the intensive care team and trying to buy more time is the way forward. Especially since you have told me yesterday that he's on multiple inotropes or vasopressors and also still on strong sedation, like midazolam and fentanyl. It's an indicator that your dad is not doing great. What should have happened earlier in his admission is to do a tracheostomy, and for whatever reason it never happened. That's why I always say that families in intensive care need to look for advice early on, so that they are informed about multiple treatment options. Intensive care teams are not always open and transparent in relation to treatment options. It sounds to me like you only found out about the tracheostomy as well as the potential for a lung transplant in recent days. It doesn't sound to me like you and your family have been informed from the start about tracheostomy often reducing the need for sedation and therefore increasing the chances of recovery. It also doesn't sound to me like you have been informed about ECMO, sometimes being used as a bridge to a lung transplant if ECMO can't be weaned. Reducing sedation also often reduces the need for inotropes or vasopressors, which is another major form of life support. Also, with ECMO unable being weaned at this stage, the ventilator can't be weaned either. Also, keep in mind, Sue, you said your dad is on 35 to 40% of oxygen on the ventilator. However, he is on 100% of oxygen on the ECMO. So you can really ignore the oxygen he's getting on the ventilator because he's getting 100% of oxygen via the ECMO. So therefore, your dad has been on 100% of oxygen most likely for a number of weeks now. So the normal steps when weaning VV ECMO for lung failure is to wean ECMO and then wean the ventilation. In very rare situations, patients can be on ECMO awake and off the ventilator, but this is very, very rare. In your dad's situation, unfortunately, he never regained consciousness in the first place and has stayed in the induced coma because of the breathing tube as well as his critical condition. Furthermore, you are asking if 4 weeks in an induced coma is a long time, and yes, it is a long time, and the more time spent in an induced coma can be minimized, the better it is. Generally speaking, you could keep a critically ill patient in an induced coma for a very long time. And again, I have written an article and made a video about how long can you keep a critically ill patient in intensive care in an induced coma. Again, you can check out that article and video if you're clicking on the link below this video in the written version of this blog. What's also important to know, Sue, is there is significant deconditioning occurring during an induced coma, and therefore the longer time spent in an induced coma, the longer the recovery time, generally speaking. Again, an early tracheostomy could have reduced or minimized the need for sedation and the induced coma, and therefore it might have improved the chances of recovery. Normally, a tracheostomy should be done about the 14-day mark of ventilation with a breathing tube. And it hasn't happened, and it hasn't even been brought up with you as an option, which I think is very disappointing. But again, it also goes to show that it's so important that families in intensive care seek advice early so that they're fully informed about any treatment options that the intensive care team may not want to talk about. You mentioned, Sue, that your dad has been stable with treatment, and again, that will only refer to the ECMO, the inotropes, the vasopressors, and the ventilation. Therefore, those are all major forms of life support, and without it, your dad couldn't survive at this stage. Therefore, stable with treatment means that the current forms of life support are keeping your dad alive, and he's stable on life support. In terms of the upcoming meeting you'll have with the intensive care team regarding your dad's situation, I would suggest to be prepared as much as you can. We should be getting on the phone before the meeting so you know what to expect. I have been in dozens of family meetings in intensive care over the years, so I know what's going to come up. I also, again, have written some articles about family meetings in intensive care, and you should check out Family Meetings in Intensive Care or The Elephant in the Room. Or you should check out the top 3 mistakes you are making in family meetings with the intensive care team. Again, the links to those articles and videos are in the written version of this blog below this video. Also, as you know, I can call into the family meeting as well, of course, if you want me to. Again, Sue, 3.5 weeks in ICU and ECMO and unable to come off it with the underlying HIV and on 100% of oxygen, it's not a good starting point. And I really do believe that you and your family have to brace yourself for your dad approaching his end of life in the next few days. At this stage, I do believe your dad is in a real and not perceived end of life situation. And I do think that anything that could have improved his situation should have been done in the beginning, such as tracheostomy and or the option of a lung transplant. I think the next best step is to get on the phone again tomorrow and talk about the upcoming family meeting. I'm wishing you and your family all the best. So, how can you become the best advocate for your critically ill loved one? Make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care. You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on the Contacts tab. Also, check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone or via email by clicking on the Products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.